Continuing with Objective 5, now we're going to define, pronounce, and spell diagnostic terms related to the musculoskeletal system. And there's only 3 of them. The first one, arthrography, radiographic imaging of a joint with contrast medium. Arthroscopy, visual examination of a joint. Electromyogram, record of the intrinsic electrical activity in a skeletal muscle. And so they're just breaking up and analyzing the term electromyogram. So the procedure shown here is an example of what, and so hopefully you are choosing B for arthroscopy. They are giving you the breakdown of it right here. And then that was pretty short, so let's just go with Objective 6. Now we're going to define, pronounce, and spell complementary terms related to the musculoskeletal system. And there are quite a few here, but as you can see, they're all very similar. All the prefixes and suffixes are pretty much the same. They're only changing the word root. So, arthralgia, pain in the joint. Atrophy, without development, process of wasting away. Bradykinesia, slow movement. Carpal, pertaining to the wrist. Clavicular, pertaining to the clavicle. Costochondral, pertaining to the ribs and cartilage. Cranial, pertaining to the cranium. Dyskinesia, difficult movement. Dystrophy, abnormal development. Femoral, pertaining to the femur. Fibular, pertaining to the fibula. Humeral, pertaining to the humerus. Hyperkinesia, excessive movement, hyperactive. Hypertrophy, excessive development. Iliofemoral, pertaining to the ilium and femur. Intercostal, pertaining to between the ribs. Intervertebral, pertaining to between the vertebrae. Intercranial, pertaining to within the cranium. Ischiopubic, pertaining to the ischium and pubis. Lumbar, pertaining to the loins, the part of the back between the thorax and pelvis. Lumbocostal, pertaining to the loins and the ribs. Lumbosacral, pertaining to the lumbar regions, loin, and the sacrum. Myalgia, pain in muscle. Osteoblast, developing bone cell. Osteocyte, bone cell. Osteonecrosis, abnormal condition of bone death due to lack of blood supply. Pelvic, pertaining to pelvis. Pubic, pertaining to the pubis. Radial, pertaining to the radius. Sacral, pertaining to the sacrum. Sternoclavicular, pertaining to the sternum and clavicle. Sternoid, resembling the sternum. Subcostal, pertaining to below the rib. Submandibular, pertaining to below the mandible. Submaxillary, pertaining to below the maxilla. Subscapular, pertaining to below the scapula. Substernal, pertaining to under the sternum. Suprapatellar, pertaining to above the patella. Suprascapular, pertaining to above the scapula. Symphysis, growing together, such as or as in symphysis pubis. Tibial, pertaining to the tibia. Unoradial, pertaining to the ulna and radius. Vertebrocostal, pertaining to the vertebrae and ribs. And so now we have the complementary terms that are not built from word parts. Chiropractic, system of treatment that consists of manipulation of the vertebral column. Chiropractor, specialist in chiropractic. Crepitus, crackling sensation heard or felt when two bones rub against each other, or grating caused by the rubbing together of dry surfaces of a joint. Orthopedics, branch of medicine dealing with the study and treatment of diseases and abnormalities of the musculoskeletal system. Orthopedist, physician who specializes in the study and treatment of diseases and abnormalities of the musculoskeletal system. Orthotics, making and fitting of orthopedic appliances such as arch supports used to support, align, prevent, or correct deformities. Orthotist, person who specializes in orthotics. Osteoclast, type of bone cell involved in absorption and removal of bone minerals. It works in balance with osteoblasts to maintain healthy bone tissue. Osteopath, physician who specializes in osteopathy. Osteopathy, system of medicine that uses the usual forms of diagnosis and treatment but places greater emphasis on the relation between body organs and the musculoskeletal system. Manipulation may be used in addition to other treatments. Podiatrist, specialist in treating and diagnosing diseases and disorders of the foot, including medical and surgical treatment. prosthesis or prostheses, which is plural, artificial substitute for a missing body part such as a leg, eye, or hip replacement. Rheumatologist, physician who specializes in the study and treatment of rheumatic diseases. And rheumatology, study and treatment of rheumatic diseases, musculoskeletal diseases characterized by inflammation and degeneration of structures. So let's look at these next few slides. So the term dystrophy means what? So hopefully you are choosing letter B for difficult movement, because if you just memorize that the prefix dys means difficult, then you should be able to get the right answer. This is an example of a prosthesis. What specialist or specialty will the patient see? And so rheumatologist, which studies rheumatology. And then on this side, orthopedist, who studies orthopedics. And so here they're just basically comparing the specialist and what does that person do. We've gone over all of these already, so I'm not going to reread it. And so that will end this recording.